Kimberly.
Hey, how are you?
I'm okay. Nice to see a beautiful face. How are you doing today?
Nice to see you. You look so gorgeous as well. Look at you.
Oh,
I love the hair as well. I'm obsessed. So it's so
yeah.
nice.
It's
Gorgeous. This is the length that I'm trying, I'm trying.
yeah. I think I've had this now for about 5 years, but I think I'm gonna take it out. I'm really enjoying it. It looks really
Oh,
cool.
no, it looks like it's so full as well. So this is lovely.
So
I like
thank
it.
you. Nice to finally see your beautiful face. So
Well, it's nice to see you too as well. So thank you for having me here. Thank you.
yeah, you're welcome. So, can you do an introduction? Just introduce yourself, your name, the trust you're training at, and just your background as well.
Okay, so hi everyone. So my name is Kimberly. So I'm an STP trainee in biochemistry. So I've been working at Maidstone and Tunbridge Wells Hospital. So I'm based at both hospitals. Yeah. And before that, I used to be a biomedical scientist. So I have a degree in biomedical science. And then I did that for about 5 years before applying for the STP.
Well, whereabouts is Maidstone and Tunbridge?
So that's in Kent. So that's based in Kent. Yes. Yeah. Yeah.
Okay, Kent. I don't know so many places. I'm just like Maidstone and Cambridge. Yeah, that's fine. Yeah, so clinical biochemistry. That's gonna be an interesting one because my undergrad is in biochemistry,
Oh,
and
wow. Oh, that's so great, actually.
yes, I had my undergrad in biochemistry, then my master's in biomedical science. So I've
Okay.
always wanted to like
So
hear
I'm
about
curious as well
biochemistry.
because I'm like, how did we end up here?
Oh, okay. Anyway, I'm just gonna give a very quick ones. Actually, yeah, I did biochemistry, and along the line, I just became very interested in cancer as a disease, especially because I lost my grandma at some point, and I just wanted to know what it's all about and that. So during my masters, I kind of picked my specialist module to be related to cancer, and my project as well, my dissertation was around cancer. Then when I found out about the STP, I had the option of biochemistry, then cancer genomics, and I picked cancer genomics because yeah, because I just became very interested in cancer and less interested in biochemistry. But it's cool. I still like biochemistry anyway.
But that I suppose it's still kind of still relevant as well with the fact that, it's still pathology as well, right?
Yeah. Okay, so talking about biochemistry, can you just
Oh, yeah.
give us a brief overview what your specialty about clinical biochemistry is about?
Yeah, so clinical biochemistry, so we look at processing samples. So we give diagnosis for tests that we do. So we're testing feces, urine, blood samples, CSF samples as well. And then sometimes we are monitoring like maybe drugs. We're monitoring the progression of disease through these biochemicals. And then also, yeah, see, I'm not sure. Predominantly the role of the clinical scientist is to authorize results. So it's kind of a bit different in biochemistry because you've got a lot of reliance on biomedical scientists as well, because we're getting a lot of work through. So the biomedical scientists mainly focus on like getting through the chemistry part of the results because that's really urgent. They need to be acted up on. So that's a 24-hour service that's provided continually. Whereas clinical scientists work from 9 to 5 and they don't work at the weekends, but they will predominantly be looking more at like immunoassays and so those immunotests may be a bit more complex because they're related. So if one goes up or the hormone goes up, another hormone goes down. So you've got to take a bit of time sort of trying to figure out what's actually happening and like sort of paint the clinical picture and then sort of relay what's happening to maybe the clinician or the endocrinologist team as well, because so we work quite closely with the endocrinology team as well in the hospital. But yeah, I'm not sure if there's anything else.
Yeah. So, talking about the biomedical scientist and the clinical scientist, I kind of get the difference you've just explained. But talking about the test, does that mean the ones the biomedical scientists authorize are like the urgent ones, the ones that are very quick? The ones you guys do, it kind of take more time, or
So something along those lines as well. Yeah. So let's say a patient comes into hospital, into A&E. So if they have their electrolytes or their sodium and they're quite deranged, they need to be acted up on, like, straight away. Whereas sometimes a tumor marker, which the clinical scientists will validate, might sort of, take maybe 1 or 2 days, but then it's not sort of urgent. So the
Yeah.
diagnosis is still given, but maybe it's not sort of very urgent, but it's
Yeah.
kind of tried to split in that way as well. But then sometimes there are results which are chemistry results, but they might be of a complex nature as well. And they're given to the clinical scientists as well to sort of try and, so without just using the results in front of you, then you can look at the patient's history, look at what medication the patient's on. So you have a bit more time to sort of study the case per se, if that makes sense.
Yeah, that makes a lot of sense. So, specifically, what kind of disease do you guys look at? Like, what sort of specific tests do you guys run?
So this is why I get so interested in this. So this is why I sort of picked biochemistry in the end. So we are looking at generally the whole entire sort of body, but we look at different organs. A lot of the times, the tests that are predominantly requested in biochemistry are U's and E's, urea and electrolytes, but that's kidney function. So we look at liver function. So we also look at the gut as well. We look at acid base balance as well across the whole body. So that's involving the liver as well. So there's quite a lot of things that we touch up on, like even celiac disease as well. We'll look at that as well. But then we might send that as a referral test to immunology, but they come through into biochemistry as well. So you get a sort of a good display of different sort of diseases within biochemistry, and like cancer as well. For tumor markers, we look at cancers. So we also look at endocrinology, sort of Cushing's disease, Addison's disease. So those types of things as well, like will also come, I generally call them a whole body kind of system as well. So you get a massive mixture of things, I think.
Oh, wow. That's a lot. I actually didn't realize it was that much. But yeah, that sounds really interesting. Coming down to the STP rotations, I know you're in first year, so
Oh,
for your
yes,
first
yeah.
year, what rotations do you do?
So for the first year, because the degree is based. So we've got immunology as part of the degree, genetics, hematology, and biochemistry. So I've already done my genetics rotation. I'm going to my immunology rotation next week, and I'm going to be there for 12 weeks. So this summer,
12 weeks!
I know, I'm so excited about. So it's at a different hospital. So I'm going to be hosted by one of the other hospitals within Kent. So it's William Harvey in Ashford, and that's really, really exciting for me to just sort of change routine and see how other hospitals also work as well. And then my hematology rotation is hosted partly by my own hospital, and then I'm also going to go and look at hematology also at the other hospital as well, just to have a comparison. And then biochemistry, being biased, but yeah, so I'm based at my own hospital. I spend a lot more time in biochemistry.
Yeah. As part of my first year rotation, I did a hematology rotation, and I did my histopathology
Oh,
before
wow.
before I went on to heme. So when I got to hematology, I was actually amazed because hematology, they kind of share the lab with
Oh,
chemistry.
yes,
I just
yeah.
watch the way the samples are traveling, and I'm like, so cute. Then the everything is very automated, and I'm like, wow, that was just like my first experience of a hematology lab and the chemistry lab, and I was just amazed at how automated everything was, and it's really amazing. Then for your rotation, I'm just curious about what how far you guys go with your genetics. Did you like do so much, or like how far did you get in with the genetic
Yes.
rotation?
No, so my genetics rotation, interestingly, it was all hosted online.
Mm.
So we never actually went inside a laboratory, but then we had all these links, which they were pre-recorded, but they took us around the laboratories in North London, I say North London, North England. So around Liverpool, around Manchester as well. So we got an insight of that, but everything was predominantly based on teachings from geneticists. You had genetic technicians come in, you had clinical scientists as well. So they were just giving a background on their job role as well. But then we also got into some specific topics like cystic fibrosis as well. And then we also had to do like sort of a presentation. So we went to the Genomics Festival. So this is the only one day where we all we all got to mix together. So we went to the Genomics Festival and I really loved that. And I thought it was so interesting. And it kind of brought back that like undergraduate, like sort of research, like thinking, like because watching other people present their projects as well got me really, really excited as well. So I enjoyed that a lot. And then I think my presentation was on CRISPR and Cas9. And I was like, oh my gosh, I completely like forgot how cool this is. Like you can edit the genome. Like
Yeah,
how I
yeah.
thought that was, yeah, so revolutionary. So I'm like, wow.
I
But I enjoyed it.
I couldn't attend that conference because it was a day after an exam. We had two exams
Ah,
in Manchester, and the
uh-huh.
conference was supposed to start the next day. So I just couldn't. I was just.
Well, but there's next year as well. They've already put out, a floor plan of the next year and what they're going to be doing as
I
well,
can't
right?
afford to miss it because I think it's a great opportunity to meet everyone and kind of network and all that. So I'll definitely try to attend. Though I'll be attending one this week in Birmingham, but that is more, yeah, that's more of a genomics conference.
Oh,
And
that's it. Yeah.
yeah, but I'll try to attend the one in yeah. Okay, so what kind of stuff do you get to on daily basis? So just like a day in your life, or if a day in your life might not cover everything you do, let's say a typical week in your life, what is it like as a trainee in first year?
So as a trainee, so it's quite interesting. So having a bit of background within the laboratory itself. So working as a biomedical scientist. So when I went into the laboratory, I was actually very comfortable with seeing specimen receptions, seeing also how the biomedical scientists worked as well. So in terms of what I kind of do now, I'm more focused on getting my portfolio stuff done. So I'll kind of have a look before I go into work. I'll know what I sort of want to tick off or what training activity I want to do. So then with that in mind, I'll go into the laboratory. So let's say if it was to do with quality, I might sort of hunt down some quality members, kind of see whether I can observe them and stuff like this. And then because I've sort of had that comfort with also QPulse as well, the systems that they're using, so I can kind of pretty much pull out what I need and extract the data myself from that. So that's when I'm doing sort of training activities. I sort of pick what I want to do and then I go and shadow it. And then I sort of take some time out of the lab and go and write it up as well. But then I've had quite a lot of different opportunities actually. So I've been to clinic. So I've been to Dr. Ali, he hosts a lipid clinic. So just being able to watch, so he's the head of the department. So being able to watch him in action as well and actually see patients, because that's not a lot of things that we get to sort of face. We're so much in the background, but then being able to see a patient and link that with disease as well and realize it's not just numbers anymore. And then, that's really, really fascinating. And also when you now have questions as well, because then I remember showing up and thinking, wow, I don't actually know a lot apart from this is critical, this is low, this is, high. So now it's to sort of now be able to link that up with different patients as well. So I really find that interesting. Sometimes I attend on a Wednesday MDT. So endocrinology MDT is where generally you find a lot of clinical scientists and biochemistry. So our general role is to sort of either have a bit of an input about laboratory results. So whilst they're talking about certain patients, we're able to get the results up and be able to display those and talk about tests that are currently being done or waiting to be done. But that's really, I think in that, I kind of sit in the background because I don't have a lot of clinical knowledge, and you have all these brilliant people as well. They know things from the top of their head. You give them a number, they're like, no, it's this. I'm convinced it's this. Have you tried this test? So I'm learning so much from them as well. So just being able to watch the whole team as well and how I'm supposed to fit in as well and watch other clinical scientists take lead as well. It's really, I find that really enjoyable, but then I also find it kind of nerve-wracking as well because I'm like, don't ask me any questions. Don't ask me any questions. I don't know anything.
Yeah, this is always the best part of the STP for me when I speak with my fellow trainees and I see that we are all kind of going through the same process. I'm like, okay, yeah, it's normal. We're all experiencing it. The first time I attended an MDT, I was
Yeah.
like, no, I don't know anything. Like the doctors, the clinicians, the consultants, then the clinical scientists themselves, the way they talk about the tests, the genes, and I'm like, no, are you sure I'm in the right place and all that? But it's actually amazing. It's really interesting to see how different specialties come together to take a decision about a patient. I think
Yes.
all comes together about the NHS values, what the NHS stands for, and how important the patients are to them. So it's very interesting to watch. I also had an opportunity to attend a clinic as well because our role is not patient facing. So having the opportunity to sit there and watch the clinician use the test we run in our lab to make a decision. I'm like, oh wow, that's actually yeah, that's actually amazing. I also enjoy that part as well. And I also wanted to ask you, you mentioned earlier that you had a previous experience as a biomedical scientist and you
Yes.
worked about 5 years. So now that you are back in the lab, in a different capacity as a trainee clinical scientist, is there any difference for you? Because I know you already you're very familiar with most of the processes, and some of the training activities might want you to like watch some of the things you've done before. So what is that experience like for you? Because for me, I didn't have a previous NHS lab experience, so it's completely new. But for someone like you, what is it like, and how are you managing the fact that you do most of those things?
So I think it's in the beginning, I was also confident that, you know, it was going to sort of set me on the right tracks as well. And it creates a really nice baseline for you to be able, even as a biomedical scientist, there is so much knowledge that you have to know as well. And because you're processing work really quickly as well, and, you know, sometimes you might not get to see a certain test for a really long time. So it's nice to like sort of reassert that kind of learning as well and learn that, oh yes, what I did learn was correct, or actually I need to build up a little bit more on this area or have a little bit more knowledge in this area. Because so compared to where I was before, a lot of the the biomedical scientists, they they have their specialists done, but here what I notice as well, that they've got biomedical scientists taking part in clinical cases, which gives them an extra level of clinical knowledge as well, which I felt like I didn't actually have as much compared to the biomedical scientists. When I saw them, they had a lot of clinical knowledge, and that for me was like, wow, like I really need to work on my, you know, my clinical background. It's not just, you know what I mean, it's not just enough to know that, okay, this is critical, this is how I would act upon it. But because the job is also a bit different, it's shifted a little bit different, because you are reliant on machines to give you a number. So you're also reliant on, you know, your QCs, running those QCs as such. In this other role, I think I'm allowed to focus a lot more on the clinical aspect and pay attention to the clinical aspect and digest that until I know it, because there's sort of, you know, so many different differential diagnoses. The results come in the laboratory. As a biomedical scientist, I could look at it and be like, oh, that's hypernatremia. But now I'm like, oh, which type of hypernatremia is it and why is it happening? So it gives me that sort of focus on it. But having the foundation and understanding how the machines work, it has made the training activities definitely a lot easier to sort of, because it seems as if it's just reflective work as well, you know, in that aspect, which it is. But then I can sit there and be like, so how did we also differ from my new laboratory? So I've got a comparison basis as well to be like, well, actually, I've used this test, whereas you guys are using this test, and I can kind of compare and try and see where I can meet in the middle or find anything, you know, why this is maybe an advantage, or actually maybe we should move to this test because, you know, this is what most people are using these days as well. So
Oh well,
yeah.
that means you have a lot to talk about in your in your reflections for the training activities.
Far too much. I think my training officer might be a little bit, you know, like, calm down, calm down.
It's part of the training, I guess. The university part that you are doing, does it help with the clinical knowledge as well?
Oh, absolutely. Yes, yeah. So because like I said as well, we're rotating through immunology, genetics, hematology, and biochemistry, but they're also the modules that we're learning at university as well. Having that, because if you look at a chemistry book, there's so much content in there, but then being directed to what actually you are supposed to be taking in the most as well, I think it's really, really niche as well, especially when it came to bone, because the bone, you could be looking at so many different things, but actually it's some things are really, you know, you're going to see them and you're going to encounter them within an NHS diagnostic laboratory a lot more often. Therefore, it pays to have that knowledge in the first year, like really grounded and really certified. So I think it's really, really helpful in that sense.
Yeah. Then talking about the university, what university do you guys in biochemistry attend?
So we attend Manchester University. Are you not at Manchester as well? I thought you guys.
Yeah. Yeah. I mean,
Oh
you know,
yeah,
there's
okay. Ah, I see it because
there's
then
University of Manchester and there's Manchester Met.
I see. Okay.
So which one is it? University
So
of
University of Manchester is where I would get my degree from, and I think we stay there throughout. Yeah.
Oh, okay. That's nice. Then talking about the reflections and talking about the university, how are you finding balancing the STP, both the work-based assessment and the university part and life generally? So how are you balancing everything?
So it's kind of strange to say because I really wanted to get onto the STP that everything else I was prepared to put a hold on, for instance. Like I came off social media at the beginning of this year and I said, you know what? There are some things that I don't need to distract me a little bit too much. But then and I wanted to really like give it my all within like my work kind of based understanding and knowledge as well, especially when it came to clinically, when I had that sort of revelation that, wow, this is going to take a lot of work, because I think you've got the opportunity to also do the FRC Path 1 and FRC Path 2. So if you pay attention right now, you know, I know that's going to be really useful if you want to take those exams like after the course as well. But in terms of balancing, I want to say university has been pretty kind because we're not constantly there at university, and we've also got the lectures to look at in our own time, guaranteed, but it's there, it's online, and it's not sort of something that you can't sort of schedule in yourself. So you can make yourself a friendly timetable, because I get a study day, and I think most STPs get one study day a week. So if you organize yourself, and I think that's the one part where when I left the job of a biomedical scientist, I was so used to coming in the laboratory and being like, right, where should I go? What should I do? And having that organized for me by somebody else and knowing, oh, actually, I need to do these tasks today. But it became so different when, yeah, so then I'm having to sort of learn how to organize myself. I think that was one of the challenges as well, rather than, because a lot of the material is pre-recorded as well, especially for the university lectures. And you now have to schedule that in yourself and be like, right, so after maybe learning this, I need to go and look at these materials. But because you've got all of them available to you, you make that own sort of timetable yourself, what works with you. So I kind of had a thing where I was studying in the morning, and then in the afternoon, I would sort of allow myself to sort of digest and try and sort of intake what was happening at work, kind of thing. And then be like, oh, okay, this is what I learned this morning. Let me try if I can find a way to solidify it, you know, by getting that experience as well. But other than that, I think the work-based training activities are also a bit challenging in the sense that you're sort of, for biochemistry personally, I'm responsible for my own training activities. So I need to organize, especially when I'm in my biochemistry rotation, I need to know what I need to learn, or, you know, what it is that I need to solidify and get that experience, and then make sure to write it up as well. And sometimes it's not as easy, perhaps. Like, so sometimes I will have a plan in my head and I'll be like, right, so tomorrow I'm going to go in and I'm going to shadow, and then I'm going to write up for a few hours. But then sometimes you hear, oh, let's go and see this, or actually this will be good for your experience. So then you kind of are having to transform and change your organization as well. But it's stuff that will occur also when you're working as well. So I think it's good to be flexible as well and actually learn to be able to adjust. So I think that's what it is. It takes a bit of learning and adjusting as well. But
Yeah.
how have you found it? Yeah.
For me, it's like the same thing, basically, because you organization skills and being very organized and time management as well. Because, excuse me, because bulk of the training kind of lies or depends on you. So it's left for you to decide when you're going to watch this, when you're going to write this. No one is there to chase you around. You have to do it. You know,
There, yes.
When I have people ask me how I'm finding the STP and ask me about how to prepare and all that, and because of my social media, I kind of communicate a lot with most of the applicants.
Oh, yes,
And
yeah.
I know that this year they asked them what skills they have that make them an ideal trainee. And I'm like, it has to be the organizational skills and your time management, because as a trainee, just like you said, I come to work, I look at my training activities and what do I need to watch in order to write this off. It's left for you to decide. You have to do all that. Then you might have the university part, you might have assignments that are due, you have exams coming up. You need to know when to kind of force the training activities to focus on the exams. And when
Yes.
you are, so it's a lot,
Mhm.
honestly. I think I agree with you that being very organized and managing my time well has really helped me a lot. And I made like different spreadsheets. And do you know the funniest part of this? You are there thinking that, yeah, I have everything in place. The professional practice training activities will just show up from nowhere, like, hey. Then I remember I have like 20 professional practice training activities I need to write. I'm like, okay.
No, that's absolutely true. This one as well, because the IBMS day was the other day as well, and I was like, public engagement, that will work.
Yeah, yeah. Yeah, when I was starting the STP, I think I found this on someone's page where they said you don't need to rush into the training activities because along the line you find evidence for
Yes.
most, and it's kind of difficult to believe some advice when you hear, because when I started off, I felt like I'm not doing anything here. And they're like, don't worry, take your time. But right now, I feel like both the conference and getting opportunity to talk to people, public engagement, just like you just, I feel like, oh, I think this will work. The one that talks about the patient pathway through your hospital or
Oh,
something
yes, yes,
like that.
yes, yes.
So when I attended the clinic, I'm like, I think this can sign that training
Right.
activity
Yeah.
up. I had to go to that training activity. I looked at the considerations. Then that helped me to like make note of what I should be looking out for. So that's the organization we talked
Uh-huh.
about. You need to like have it all together, and you keep, I don't know, just keep going.
But this is the thing as well, absolutely, like you say as well, because I think for me, what was intimidating, like in the beginning, was looking at all the different training activities and being like, ah, right, so it says 0%, And then I kept worrying and calling all the, like some of my friends as well and be like, so how much of your training activities are marked off or how much have you done? But once you get into it, actually, you realize one is complete, another's complete as well. And it starts to move as well, which is nice, actually.
Anyway, that's cool. So let's take it down to where it all started from, the STP application. I know that biochemistry is one of the most competitive STP specialty. So how did you get into the STP? What did you do with your application to stand out? And by the way, is this your first, did you get in the first time or have you tried applying to the STP before? And what did you do to make your application stand out?
Okay, so this was my first time applying. So I was working, so I think I'll just take it a little bit. So I was working as a BMS, and I kind of knew, especially when I started, that actually maybe I might want to be a clinical scientist. So I really have to pay attention to, my job role and everything else that was going on around me. So when I applied, I'd also applied for I thought, let me see how I can better improve my chances. So I was working as a band 6 and there was a band 7 position that also came up. And I was like, if I can get that thing on the application, that's going to look really, really good as well, and also have some experience with leadership as well and managing people, because that's one area where I thought, oh, I know that I don't have a lot of experience in leading people. So what if I sort of challenge myself to do that? So by the time that I had applied, I'd also had applied for this job role as well. So I knew at the time that actually I've got this thing that I'm going to be doing. So it's going to give me this experience. So even when I was speaking as if like I know how to lead people. I know how to do this in that kind of sense as well. But really and truly, like by God's grace, I don't know how it happened, but it was a challenging application. But I was also fortunate enough as well that the hospital that I worked at, although they didn't take in-house applicants for the STP, they did have clinical scientists at the laboratory. So I approached 2 clinical scientists last minute because we know how tight that application was as well. So last minute, I recall approaching 2 clinical scientists and I said, please, 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 may you just read through this and just check that I've got everything that I need in there. And they kind of read it through, and one gave just a tiny bit of feedback, just a little bit of feedback, was like, just tweak this. This sentence doesn't make sense here. And then the other gave quite a lot of sort of input to be like, this is really good, but use it to your advantage. You've been working as a BMS, you've got that kind of foundation. So really talk about that as well. So I talked about my experience a lot within the laboratory. And I think the mainstay as well, that, I wasn't trying to move away from the NHS. I just really wanted to build myself up within the NHS, So I think for me, later on, even as I realized, it was really also important, that dedication and that passion also to make a difference in a place as well. And I think if that comes across, I think it can make a difference to an application as well. And I think it was like when I first finished uni and came to, to the laboratory, I was like, I'm going to change the world. That kind of vibe, yay, I'm so excited. I'm ready to make a change. And then slowly, as the layers start peeling, you realize if I want to make a difference, I've really got to also push myself to be a leader as well, somebody that can, stand out. And then, so I think by having that, so I think definitely the name dropping off, I'm currently a band 7, really helped with my application, because I think it just showed within a few amount of years, I was really committed to sort of graduating, getting those positions, and sort of just working my way up as well, and just committed to biochemistry as well, and NHS as a role.
Well, that sounds like really interesting, and it shows the level of commitment and the level of work you put into your application. Then what about your interview? How did you find your interview? Did you do anything differently about preparing for the interview?
So
Well,
I get really, really nervous, especially when it comes to interviews. I get really worked up. So the only way I can sort of calm myself is to be very, very prepared. And that is in terms of knowing the laboratory, knowing NHS values, knowing all that kind of what I'm applying for, having read my application inside and out, and being able to sort of even think, actually, what if they ask me about this? Am I able to expand a little bit more on that, just on a general basis, rather than speaking specific questions? I would look at sort of my application. Look, I talked about EQA. What if they asked me to expand on just that particular topic? Am I able to do it? So it was using that as a base and being able to challenge myself and to try and expand outside of just what it was there or what I just learned. So it made it easier. So let's say if you were talking about IQC, then you can bring in EQA, then you can bring in the quality. So it just kind of worked as a whole, I think in that sense. But other than that, I think the interview questions, and I think this is maybe pays to be over prepared, because I genuinely was shocked by the interview questions. I thought they were good questions.
okay.
I don't know what I was expecting. And I know sometimes maybe medicine is the only next best thing that I could also compare it to, in that sense, for me at the time, to think maybe these questions, maybe they'll ask how a specific equation will work in that sense. But I found the questions quite gentle, but then you had room to work around the questions as well. They weren't specific or directly specific to tell me this chemical, it talk about an assay or two, or talk about an immunoassay, or talk about chemistry assay. And for me, that was one of the most beautiful things that you could do. You could talk about the ranges, you could talk about the measuring, how it's measured in the laboratory, you could talk about its clinical influence outside the laboratory. So, you had room to move around wherever you wanted with those types of questions as well. So I enjoyed that. But there was one question which, for the life of me, I don't think I will ever live down. They asked me about a system, and I talked about a system of quality management. Yeah. So they said, and I was talking about it, and they were asking, they were like, do you know what the name is? like, as you know, they expanded on the question, they were like, what's the name of this? And then in my head, I was going, and then I remember I kept explaining it and I kept explaining it. And then I was like, I can't remember what the name of the one I use is, but it is a management system, but it was QPulse. And
My days.
but
Your
but then
pulse.
imagine, but then I was like, and I remember feeling really low, like after the interview, because I kept remembering that question and I kept thinking, like, you didn't even know Q Pulse, like, you couldn't even say Q Pulse, like, in that.
I think it makes the difference. At least they are sure that you know what you're talking about.
Yes.
And I also attest to the fact that you said the questions were very gentle. And I found the interviewers were also really helpful as well. So I had the same opportunity where I had a question. I kept explaining, and they're like, they're kind of like, they really wanted me to get the answer. So I was saying something else. They kind of rephrased the question. I'm like, oh, then I gave them that. So yeah, I agree with you that the questions are gentle and the interviewers themselves, they are lovely as well. They are not there to just arrest you
Absolutely.
or judge you. They're not there to just assess your knowledge. So yeah, I agree with you. But from our chat so far, I think kind of putting things together as to why biochemistry is heavily competitive. So for people like you that already have the experience within biochemistry and a lot of biomedical scientists applying, so like probably that's why persons that don't have a lot of experience maybe find it difficult to get into biochemistry, because you guys are very experienced, and then coming against people like you, I think maybe that's why it's difficult to get into biochemistry. But honestly, it's amazing hearing from you, because I can see that you're very passionate about what you're doing. And yeah, it's very evident. When you hear someone speak and they love what they are doing, you can just hear it from them. So it's actually very
Thank
interesting.
you.
But if you
No,
have
I
to,
just wanted to touch up on, just to add to, so on the course, we got to meet the people who are also, who interviewed and actually got those positions in biochemistry. And myself, I was interested to see, so who made it at this level, or what is it about it? And there was a mixture as well, I felt as well. The experience really does account for something, especially in that area. But then I met a few people who'd come from university as well. But and it's also that commitment to your learning as well, and that sort of, I'm going, you want to be able to make a difference in the laboratory, or like be somebody who's going to, be able to help develop and grow the laboratory. And I think that's really, really important to be able to show that, like, I'm hardworking, I'm experienced, so, I want to be able to bring growth to this area, or even the NHS as a whole, rather than just your particular, like, sort of niche. But I think it's really important to show that. And for some of, because even I wanted straight from uni. Wow, like, that's amazing.
yeah,
Yeah, so that was interesting also to see that actually, okay, yes. So there are, but when you speak to some of my colleagues as well, like within biochemistry, you can see their passion as well. So this is why I'm like, huh, wow.
that's great. So if you what advice then would you give to someone looking forward to applying to biochemistry next January? How can they make a difference in their application to increase their chances of getting into the STP?
So as a whole, like, yeah, for myself, I think for me, what worked was having sort of experience, but it's not just, because sometimes you can be working in a job, but not taking a lot in as well. You know what I mean? But there was one piece of advice that I was told by our quality team when I was a band 5. And I remember, and he was like, if they ever want somebody, always say yes. And I found it really odd for somebody to say, always say yes. They wanted a health and safety training. They wanted a fire officer. I kept saying yes, yes, yes. But within all of that, like, it's knowledge that's going to help you, even in other areas, even when you're not thinking of it as well, it's going to be useful as well. And somebody else is looking at it and thinking, oh, wow, we've got somebody who's trained, but they also know these other areas within the laboratory as well. So it just makes you a really rounded like scientist. So where there are training opportunities, I would also give that same advice, is just to be saying yes to training as well. I recall there was another training that I did as well. So this was another health and safety learning and training. But when I became a band 7, it literally became so useful because I was so reliant on it, because then I was having to do the walkarounds as well, the health and safety walkarounds. And I was like, without this knowledge, perhaps I might not have got the job, because I'd also put that on my application. So the small things like that make a difference, whether it's training another person as well. Yeah. So when you have like training roles or new people come in, and I think this is another thing, because if you are in a training role, whatever role you're in, and you have a trainee come in, being able to sort of like relearn your knowledge as well by teaching other people and showing other people, it makes you even more confident at your job role or at whatever station you're at already as well. And I think that just starts to exude like later on as that confidence builds and builds kind of thing. So I think it's really important to take on lots of opportunities like that. And especially like where it comes to talking in the laboratory, I remember walkarounds where we'd have to show somebody, like one of the doctors from, and I remember being like, oh no, I don't want to do it, because what if they ask me a question about the analyzer and they end up teaching me, about my job? But then after a while, you sort of shake that off. And I think once you've shaken stuff like that off as well, you learn, oh wow, because they start talking about their own experience elsewhere, and you can make it also relevant to your own job as well. So they're just little opportunities that really help build yourself as well. But then, yeah, so I'm really quite biased because all I have is laboratory experience behind me.
Yeah.
But then I also did a master's as well after uni. So when I did my biomedical science degree, I went and did a master's. And I think just having that, because that master's also shows that, you're dedicated to your learning, you're dedicated to your passions as well. So just any type of training and teaching that shows your commitment to your passions and training. And I think also it relays when you come and do a course like this, because you're now having to organize yourself. You're now having to do another master's as well. So if you can achieve one thing, that's very much translatable to another thing as well, I think.
That's a great advice. So thank you very much. Then another advice for persons that will be starting the STP this September. So just an advice to the incoming STPs starting first year within biochemistry. So just what advice would you give to them?
So this one is very special tailored as well. Don't rely on your knowledge. Don't rely on things that you know already so really scratch everything from the surface and hit the ground running as well. So when it comes to the learning, so every time you've got your pre-recorded lectures, really follow a set basis, because having to catch up, that exam that comes up in January comes up so quickly. So if you're having to sort of prepare within last minutes, it's not going to work. There's exams, I believe, are meant to challenge your knowledge at that, at a master's level, and also to become a clinical scientist as well. So they are really challenging exams. So from September, start engaging with the material. And even prior to that as well, just start engaging with the material as often as you can as well. By the time then you get to your other exams in April, like, you're already at this level where, you've got a set base and you've got a set timetable. And I think it works really, really nicely as well. And I think that's the advice that I was also given, but a little bit reluctant to follow until after my first exam, when I realized that, wow, this
Yeah,
is.
I also had an exam in January, and that really came by very fast, just like you said. And that was quite difficult for me because, my background is biochemistry, and it's hematology and histopathology, very different specialties. I had to learn every bit of it, and it was kind of a struggle for me. The histopathology results and
Oh,
all the,
yes. Yeah.
when I look at them,
Gosh.
I just see pink and purple, but you have to be able to
This is
probably
like shading.
identify, what is, yeah, the architecture is looking different. It was driving me crazy. Then looking at the hematology side, the abbreviations. After my life, I had to learn. Maybe if I had this advice and if I started earlier on, I don't think I would have been in the position I found myself. I passed the exams, but
Yes, yeah.
I was stressed. So yeah, that's a good.
It was even, yeah, I remember not seeing my family for those, like, there was about 2 weeks where I just didn't want to engage with anybody because they gave us, I think they released like sample questions. So they gave us, I think, maybe about 14 to 15 questions. And then when I looked at those sample questions, I said, my gosh, there's a lot that's going to be required from me.
I understand. I completely relate.
So from then on, I think it clicked for me, but I do definitely wish, I'd sort of realized as well in September that just start engaging with the material, start making your notes as well, because there's nothing worse than trying to sort of make notes and then trying to sort of read them within the same sort of weeks. Make the notes before, and when it comes to the weeks, you're just reading and you're trying to just take that in. So yeah.
I think I'll take that part into my second year. So maybe after the uni, I'll make my notes so that during the exams, I'll just read.
I am telling you, because then it was like, after lectures, I recall some of the guys, oh yeah, let's just wander to let's go for lunch. I'll be finding myself writing up my notes because there's quite a lot of stuff to digest as well. So
well, that's a good one, and I agree with you. I think we've covered everything that we're supposed to talk about today. I found this talk really interesting, and I really appreciate your time. I can't believe we made it to the end, but against our odds, we finally got here. I really enjoyed talking
no,
to
I
you.
did too as well. And I
Thank you.
like your interview technique as well, because I know I'm not out here, but I felt very relaxed. I know
Yeah.
I do have a little frown, but I think this is just my thinking cap. But
No,
I found myself very calm, so I thank you as well. But this is so fun, actually.
thank you very much. I'm sure when it goes live, I'm sure the people that will be listening to it will appreciate your advice and everything, because biochemistry, everyone wants to apply and listen to someone from biochemistry. So I really appreciate your time, and thank you so much for doing this with me.
Thank you so much, Cynthia. This has been
All right.